Hello, good evening, ladies and gentlemen, and welcome to the live podcast today titled The Story of a Researcher. I don't know, but have you ever wondered or asked yourself the simple question: how comes when I go to the hospital complaining of certain symptom, let's say a headache or malaria, you are given a drug and in a matter of minutes or maximum in some days you are better? How comes the world is changing fast technologically? How comes human beings are able to do some amazing things that our forefathers can never think of? Well, the simple answer is because of research. But what is research? In the layman's term, research means the art of discovering the unknown. And that is the title of our topic today. We are joined by the founder of Center for Advanced Medical Research in Sokoto, and the person of Associate Professor Mustapha Umar Imam. To discuss this particular topic, do we need research in Africa and in Nigeria? Why is research important? And how difficult it is to get a research center to be established, especially in a society when researchers and the impact of research is not felt. Researchers are not being celebrated. In fact, the mere need of the society to researchers is not even understood. Dr. Imam had his is a person of immense level of experience. He had his training, he had a medical degree and a PhD in biotechnology, and had worked on various projects and had had experience in countries from Europe to Asia, working in China, also in Malaysia. You can say he has swept across the continents in the sake of knowledge. Thank you for joining us today.
Thank you very much for having me.
Doctor, I have had this question that is troubling me because whenever I met someone or some people with a kind of a career progression as yours, they have one single thing. They have one single thing bothering them. How sorry for the glitch. Had one single problem that in Nigeria, especially in Africa and in Nigeria in particularly, there is no opportunity for growth. There is no appreciation. And the odds of you developing your career in countries like Nigeria, it can be really tremendously challenging.
Mm.
So my first question for today is, what initially sparked your interest in developing a center in Nigeria, knowing
Okay.
these predicaments?
Okay. Thank you very much for having me, and um, thank you very much for that wonderful introduction. I would like to make a little clarification regarding myself being the founder of the Center for Advanced Medical Research and Training. You said I was the founder, but in actual fact, the idea of establishing the Center for Advanced Medical Research and Training in Usman Danfodio University, Sokoto, was actually born with the desire to establish a biomedical research center in the university, which will serve more or less like a central laboratory where researchers, staff, and students will resort to for cutting edge research, cutting edge experiments. The center houses state of the art equipment related to molecular biology, as well as other life, as well as life science in general. So the center itself was established. The idea to establish the center came up, started in 2011, when the present Vice Chancellor of Usman Danfodio University, Sokoto, was the Deputy Vice Chancellor Academics. Now, he felt there should be a central lab where researchers would carry out any type of cutting edge experiment that is conducted in any other lab anywhere in the world. So when funding was received from the Tertiary Education Trust Fund, TED Fund of Nigeria, and the building was started in 2011, but then the center itself never got to be commissioned until 2017, when at the time a coordinator was appointed in 2017 after commissioning. Now I joined Usman Danfodio University, Sokoto, like you rightly said, from China in 2019, and then I was appointed the coordinator at the time. Now, at when I joined the university and I took over the leadership of the center did not have the legal documents to back up its establishment. So we had to do some paperwork that finally that culminated in the establishment in the legal documents that finally established the center. And that was why last year, when all the paperwork was done and the center was legally established, a director was appointed, and naturally, being the coordinator, I was made the founding director. So I did not establish the center per se, but the center was established as a central biomedical research center of the Usman Danfodio University, Sokoto. I served as the coordinator between 2019 to 2022, and then from 2022, I have served as the founding director of the center.
Okay, that's a really fascinating story, and thank you for correcting me because it means I didn't get my facts correct. But as the director, can you share? I know it's really challenging, and for you to have relocated from China to back to Nigeria and start your lab in Cambridge, and now currently even serving as the director of the center,
Mhm.
it must you must have reached a certain point in which a turning point. There must be a motivation for you to like, okay, now I'm going for this. Can you share with us what is the experience? What is the kind of something that fueled your ambition to move towards the path you are currently in?
Okay. Thank you for that question. So just like most phenomena in real life, there wasn't one single defining moment or one single factor that actually motivated me to return to Nigeria when I decided to. But then I would say it's a series of events that have happened in the past that actually made me decide at the time it was the right time for me to return to Nigeria. But then when I was in 2019, I was invited by some of the top management staff of Usman Danfodio University, Sokoto, to return to the university because the university needed people to fill up certain positions, and they felt my expertise was needed in the university. And I felt I had actually reached a point in my career. I've worked in Malaysia. By the time, I mean, at the time I had worked in Malaysia, I had worked in China, and I think I was doing quite well then. And I just felt I had done enough for those places I had worked for, and then it was just time for me to return to Nigeria. And part of the reasons why I actually decided to come back at the time when I was invited was because I had actually seen when I was in Malaysia and in China. I saw how patriotic their citizens were, especially when it came to conducting research for the development of the country. Now, whatever research or experiment they did at the time when I was with them, I mean, they made it seem as if, they made it seem as if they were actually contributing, no matter how trivial their experiments were. I mean, they would make it seem to you as if those experiments they were doing were what was actually contributing to propelling the country and moving it forward. And then I felt I should also do something similar, come back to my country, and then also contribute. By the way, prior to that, I had actually enjoyed a lot of benefits from people that had supported me over the years, and I felt it was time for me to also return to Nigeria and sort of pay it forward, let other people benefit from my expertise, and then things I am able to do, I would also help other people to achieve greater heights in terms of research. And basically, that is what we've done in Camred. Over the years, we've been able to achieve a lot in terms of mentorship, in terms of building the research infrastructure in the center, and in terms of getting research grants and conducting research that is probably at par with any with research in any other lab anywhere in the world.
Thank you very much. It's made me like, yeah, when I was reading through your bio, so you have been elected, I think, for the 3 consecutive years. It was not in that as among the by Stanford, right? But among the 2% of globally recognized scientists, which is a really a big something. Did you achieve that while in Nigeria, or did you is it something that is propagatory that started since your time in China or in Malaysia?
Okay. So yes, I have actually been on the list of the top 2% of most cited scientists in the world since 2019 for 4 consecutive years. So for those that are not aware of this list, Stanford University in the USA, in collaboration with Elsevier, which is a publisher, a publishing house, has released a list of the top 2% top 2% scientists in the world who have been cited extensively by their peers in their fields of research. Now, what has happened? I mean, I was able to achieve this because of the number of publications I have had over the years, and these are not just any type of publication, but publications that are quite qualitative. And now the algorithm that is used by Stanford University is actually very fair. It can't be rigged. Now this is using data that is publicly available. Now, what it means is that if I am on that list, it means researchers in my field are actually citing my papers to build upon their work because they feel my publications are significant enough to be built upon, and the research is actually fundamental in the area that I am working on. So to answer your question as to whether or not this is something that was achieved in Nigeria or in China, it's difficult to say. I mean, this is something that is cumulative. From when I was in Malaysia, where I did my PhD, where I did my postdoc, to when I went to China, I did a lot of research, and even when I came back to Nigeria, I've done a lot of research. I've published a lot of papers, and a lot of the number of citations I have. I mean, some of them were actually achieved when I was in Nigeria. I've had lots of publications even when I came back to Nigeria, and as part of my citation count, a lot of the numbers were actually from publications that I actually have made when I came back to Nigeria.
Thank you very much. Building on that, I just want you to highlight because, of course, you have worked on a lot of projects. So along your career, can you give us an idea or like what are the do you have any project, one or two, that is particularly meaningful to you? And in that, what impact have you achieved with those projects or you are intending to have or kind of like achieve with those?
Okay. Yes. So there's actually I currently work with a diverse team of experts in our center, and there are lots of projects I'm actually passionate about. But then I have always been interested in studying the risk of transmission of diseases across several generations as a result of environmental factors in a parent generation. Now, this is work that this is an extension of work that I've done when I was a postdoctoral fellow in Malaysia. We looked at how rice diets, consumption of rice diets, would actually influence the risk of transmission of metabolic diseases, as metabolic diseases like insulin resistance and type 2 diabetes across generations. Now, the very first time we actually got the data to prove, I had read prior to that so many publications that actually said that certain environmental factors or nutritional conditions could lead to transmission of risk of disease across several generations, even when the offspring or the offspring generation doesn't directly get exposed to that factor you're looking at. So for me, when we received the first data from that particular study when I was a postdoctoral fellow that actually showed that consumption of white rice in a parent generation could actually lead to increased risk of metabolic diseases like insulin resistance in the offspring, that to me was like the aha moment. So this is actually true. And I perhaps that is probably the time that I decided that epigenetics was the field that I was going to continue to pursue.
Yeah.
Moving
So,
forward, because prior to that,
yeah.
yes.
Sorry to interject you on that. Yeah, but particularly you have talked about something that was really interesting because I know, especially in northern Nigeria, the consumption of white rice
Hmm,
is at the kind of top of the food chain. Probably, it's like in everybody's house.
yes.
To ask you
Ye-
one, since you have made this, like, how many in terms of community engagement or in terms of making that findings of yours public for public consumption
mhm,
in order to modify lifestyle, did you
mhm.
make any effort or have you achieved anything through that?
Well, so in terms of community engagement, we really haven't gotten to that stage where we will engage the community or the policymakers to say that we have enough data to believe that our observations are true or our
Mm,
hypothesis is true. Why? Because in biomedical sciences in general, we don't just jump to conclusions from in vitro experimentation or animal experimentation. We will actually have to go all the way up through several types of clinical studies before we actually have the concrete evidence
mm,
that we will then use as the basis for changing policy or engaging stakeholders or the community. So we're still some years, away from that. But then I would say the data that we have right now is actually quite promising because although this study actually started when I was in Malaysia, even when I came back, just like you rightly said, we know that white rice is one of the major staple foods for people in the northern part of Nigeria, or generally in Nigeria. So
mm,
part of the motivation to keep working on this particular project was because I felt it would actually have significant impacts for people in Nigeria in general, and perhaps if we at the end were able to prove that this is also happening in humans, then what it means is it could actually be significant for our people in terms of reduction of the risk of insulin resistance and other metabolic diseases. Besides, there's already data not in Nigeria, but in other countries, in China, in Japan, in the USA, and in other countries, where studies that have been conducted in humans, observational studies, by the way, conducted in humans, have actually made direct links between consumption of white rice and increased risk of developing insulin resistance and type 2 diabetes mellitus. So if we're to use that
exactly.
data from other countries,
Exactly.
then we
Yeah.
actually may assume that what is happening here may also be the same.
Yeah, exactly. And that is my point. And that's what I'm trying to make because I know even though our genetics, especially of the African, is not entirely the same with those of the Europe, so we cannot verbatimly apply the findings from the European
Mhm,
up to here. But no, they have much more established something. And this is something I've been having as a while thinking because in especially in researchers in Nigeria and for people like you that are making these tremendous efforts to bridge the gap, uh, there is the need of having probably synergizing the real science and the impact as well so that it will go hand in hand instead of waiting like years to be sure of what you're doing. But that is something, just an advice. It's subtle, kind of something that is subtle. But moving on, so that we'll not dwell on that. I know
yes.
You must have, and this is particularly things I've been waiting to hear. Do you have any? What are the challenges like your team have faced when it comes to
Okay.
establishing that particular place in Nigeria?
Oh, okay. Well, I would say my experience leaving China, where we had huge amounts of funding for research. I mean, I can to put this in perspective. When I went to part of the reasons why I went to China at the time was that the lab I went to work for had actually received funding of about 3 million, sorry, 5 million US dollars, and
In
this
Naira,
was just this was just a single year funding.
like
And
how
in
much in
20
Naira?
well,
How much would that be in Naira?
well, using the current exchange rate, that would be about 5 billion naira.
That
That's a
is the
lot.
yeah, that
Yes.
is the money for the whole state.
Yes, exactly. But then this was just funding for one lab for just a year. Now, I was able to actually do a lot of projects when I was there, thinking of without thinking of issues of funding. We actually were able to do a lot when I was in China. Now, moving from China to Nigeria, I would tell you one of the major problems that we have in research, bedeviling research in Nigeria, is funding, lack of funding. I mean, I know the Tertiary Education Trust Fund of Nigeria has done a lot in terms of giving research funding to researchers in tertiary institutions. But then this is like a drop in the ocean. That is very, very insignificant if you compare it to what obtains in other parts of the world. I was reading the news recently. In 2019 alone, China spent over $500 billion for research funding. I saw it on the news again that TED Fund of Tertiary Education Trust Fund of Nigeria was actually celebrating giving about 10 trillion naira over a 10-year span. That's just $1 billion. I mean, if you compare that to the amount of funding that is given to researchers in the US or in China or in other developed countries, this is very, very insignificant. So the major problem that we have in Nigeria in terms of research is lack of funding. Um, Again, another problem that we have is lack of manpower.
Hmm.
But then I would say the reason why there's a problem with manpower or people that are skilled in research in Nigeria is because a lot of researchers have been sponsored out of the country by their institutions, by TED Fund, and they've actually learnt a lot. Now, when these researchers return to the country, the problem is they are not properly placed where their skills are needed. A lot of them are actually allowed to rot and their skills waste, and so at the end of the day, nobody benefits from that training that they've been able to get. Now, in addition to lack of the manpower, another problem that I see for research in the country is lack of motivation. Now, even when people have the skills to do research in Nigeria, if they're physically present in Nigeria, the motivation is just not there. And I mean, we know why. The lack of motivation is not something peculiar to researchers. It's across various aspects of the Nigerian system. There are problems that prevent people from achieving, performing very well. So this is a problem also for researchers, and most times there isn't that motivation for them to do what to exhibit their skills or to do research as it should. Another major problem, at least for biomedical sciences or life sciences, is problem with electricity. There is no way you can do good research without stable electricity. And I know how we've actually suffered to ensure that we have constant electricity in our center. And I can assure you, without constant electricity, there is no way you can do good science in Nigeria or anywhere in the world.
Yeah, thank you. I assume that is really a lot of factors you have listed.
Yes.
And definitely you must have taken a lot of efforts to overcome those
Hmm.
challenges. But it's good
Yes.
that to have the people that are working towards that are really kind to address our issue, because with this community, we'll be able to have, as the community is widening, we'll be able to have a voice, and that will eventually shape the policy, and
Mhm.
it will make the government and people appreciate the impact of researchers. Talking on that, why do you think because this is, you have quoted like huge amount of money. You are talking of 5 billion. If we take it into perspective, this is the money that is sent to how many million people? Like you have to combine two states to get a grant of
Mm-hmm.
5 billion, but it's going
Yes.
to a particular lab of probably less than
Mm.
10 people to manage it
Yes.
within a year.
Yes. Yes.
Why do you think the country is investing that kind of huge amount of money into research? Why is it important? Why is it important?
I would say research is all about problem solving, right? And I am sure China and other developed countries have actually known this long before now, that for them to solve their problems, they will need to involve researchers in identifying the problems that they have, and then providing potential solutions to those problems. Now, at the leadership level, you politicians or whoever is in charge could actually decide to play or I mean try a few ideas if there's a problem at the national level. But then the reality is that would cost a country or any I mean that would cost a country or any state huge amounts of money if at the national level or at the state level they try solutions that they're not very sure of. So I mean research actually provides solutions to problems through trial and error at a small scale. And if there are potential solutions, those solutions could actually be amplified to the national level. And the reason why China is actually investing hugely in research is they are most of the funding that they give is for problems that they have in the country. Now, these problems are addressed by researchers in the university. Once there's a potential solution, that solution is applied at the national level, and then that will significantly reduce the amount of waste that would have gone into trialing that particular solution at the national level. And if it doesn't work, then a lot of funds are going to be wasted. But then if the solution is sought for at a smaller level in a research setting, then chances are that they wouldn't waste as much as they would at the national level.
Yeah.
So I would say the reason why they're doing this is because they want to solve their problems. They are tackling the problems that they have through research, which is evidence based.
Yeah, so just to summarize, probably I can say that what you're saying is, for any country committed to development,
Mhm,
self-sustainability in terms of economy, in terms
mhm,
of food security, in terms of the well-being of the nation, they have to
mhm.
commit to research.
Correct.
I hope
Correct.
I
Yes.
hope the policymakers will make
Mhm.
that. So moving forward, taking Nigeria as a challenge, as the point of interest, how do you think we can overcome the challenges facing research in Nigeria? Can you
Well,
think of any workable plan, or just hypothetical?
yes. I think, well, based on my experience living and working in Nigeria, at least in the research setting over the last 3 to 4 years, I think I have a couple of ideas on how research can be strengthened in Nigeria, and how research could actually be used to solve national problems. And to solve the problem of researchers in Nigeria, I think we need to address those same issues that I have raised earlier. Now, there has to be funding, there has to be commitment from the leadership, the political leadership in the country must be willing to use researchers to address national problems. Now, doing that will entail committing huge amounts of funding for research, trying to, in a bid to address problems that directly affect the lives of people in Nigeria. Now, I know, like I said, TED Fund has done a lot. We can't really criticize TED Fund for not providing funding. At present, I believe TED Fund is the only agency in Nigeria that gives huge amounts of funding for research in the country. Now, but in addition to TED Fund, other ministries, other agencies must also commit to providing research funding for various projects, at least within their own mandate. Aside from government agencies and ministries, I think it's high time for the Nigerian government to actually look into ensuring that private institutions, companies, also provide research funding as part of their CSR, corporate social responsibility. Now, it would interest you to know that the grant that I did my PhD on in Malaysia, which at the time was about $1 million. Now, that grant was provided by a private company, a private rice company in Malaysia. So if we actually have companies or private agencies in Nigeria also providing such amounts of funding to researchers in the university, that could also go a long way in addressing our national problem. But of course, we know that most companies are into business to make money. So there has to be some sort of pressure from the government for them to fulfill their corporate social responsibility. Now, there also must be a commitment by the government to ensure stable electricity. Now, when I came back, when I took over the leadership of this center, one of the major challenges we had was how do we bring in reagents and reagents that are very, very expensive, cell lines, for example, reagents for PCR and the likes. How do we bring them into Nigeria, and then how do we keep them viable for our experiment? So we actually trialed so many things, but right now, what we've been able to do is the only solution we could actually think of is to have inverters, alternative power supply through inverters, batteries, as well as solar panels. But then, of course, I mean, there may be issues with these from time to time. So the best is to have commitment from the government to ensure a stable supply of electricity, so that these problems with electricity that our researchers are facing will actually not be there. And then you buy reagents, very expensive reagents, and then you don't end up losing them just because there isn't constant electricity.
Yeah, thank you very much. Yes, and adding to that, I think what is important, especially in spite that we have a lot of commitment from TED Fund, is this is
Mm.
something that will require a lot of policy from the
Yes.
policymakers to have a lot
Hmm.
of things going on. And as you mentioned, industries will
Hmm.
definitely play, because
Yes.
the way I always see it is I see it as kind of a vicious cycle in which each one fits into another, because
Hmm.
the industry need researchers more than the researchers need industries. For
Correct.
example, whatever you are producing, take it
Hmm.
rice, or maybe someone tries to kind of utilize the abundance of sunshine in Sokoto State probably, and decide to have a power station that utilizes solar.
Hmm.
The question, the key thing, the profit is how do you get solar panels they'll be able to absorb as much as sunlight to give you more electricity. More electricity means you'll be able to sell it at more profit. And that is where
Hmm.
researchers come into be to solve
Hmm.
that problem, to give you solutions, use standard technology or whatever sort of technology to answer those questions.
Hmm.
Yeah, I think it's really important for sustainability of companies, even in Nigeria. We
Hmm.
need a functioning, the universities need to function, and especially the researchers need to function.
Correct. Yes. Hmm.
Thank you very much. So,
Thank you.
approach the half of the session. I would like to once again thank our viewers that have patiently followed this conversation together with Dr. Mustapha Imam, who is the director of the Center for Advanced Medical Research and Training in Sokoto, and he has his lab, especially focusing on the problems bedeviling health issues in Nigeria. As we go along the course of our discussion, from the
Mhm.
viewers, please, if you have any question, you can post it in the comment section. We have in the last bit of the discussion, we will have time in which we will read comments and questions from the audience. Thank you. So you have mentioned something about the lack of manpower, human resources. That means widow definitely in Nigeria. Talking about youth, we are more than 200 million people, and more than 60% probably are youth below the age of
Mhm.
5.
Mhm.
So in terms of youth, it's not a problem, but you still say that we have the problem of human resources. So do we have people but they're not employable, they don't have the skills? Is that the question? And if that is the question, probably we have too many youths that went through the university system but haven't yet acquired the necessary capabilities and skills to make them employable in terms of research, develop the thinking, the stamina for thinking, the skills, the discipline to work judiciously, to put yourself on a course of discovering something which can be really demanding. That will bring us into the issue of mentorship.
Mhm. Mhm.
Do you see how is the mentorship in Nigeria between like you yourself, the lead researcher, and someone that is working towards that? And how many of you people do we have? And how is the impact of mentorships to say that the next generation coming in are kind of a team that can be really be resourceful in terms of research?
Okay. Thank you very much for that question. Just a bit of a clarification. I mean, I don't mean that Nigeria doesn't have doesn't have good researchers per se. But then I can I can argue that Nigeria has one of the best set of researchers anywhere in the world, and
Mhm.
that is why when Nigerians that work in Nigeria under the very harsh conditions that they find themselves, when they go to environments where the facilities are there and then there's funding, they actually tend to excel in research. I think the problem is there's a particular set of very skilled and experienced Nigerians in terms of research who have actually gone outside Nigeria and they've trained. Some of them have been able to return to Nigeria to actually mentor other people. But then I would say there's a huge disconnect between those set of researchers and the other researchers that barely have the skills and are not really willing to learn the right research skills to be able to conduct very good research, either because there are no facilities for them to learn using those facilities, or because the motivation just isn't there for them to commit to doing very good research. And that is where the issue of mentorship is very important. Now, I'll give you a few examples as to why we sometimes are not doing very good research. And it boils down to lack of funding. Now, what obtains in Nigeria, in the postgraduate system in Nigeria, is that a postgraduate student will have to sponsor his research project. And
Yeah.
there's no way you will expect a student to sponsor a research project and do good research.
Yeah.
Chances are that that student will cut corners and there'll be a lot of dodgy research going on, and then at the end, the whole aim is just for the student to graduate, not to do good research. And that is an area where at Camred we're actually changing the narrative. All our
Mm.
students, for example, in the center, at least if we agree to take you into the center, your research project is going to be funded. And then there will be significant inputs from us. Of course, we give you the opportunity to design your project, to express yourself in terms of your research ideas, in terms of hypothesis. But then at the end of the day, we also will have significant inputs in terms of how the research will be carried out. But at the end of the day, once you go through our training program, we expect that you will be able to look at the literature and identify gaps, come up with hypotheses, and then you will be able to design your project independently, carry it out, analyze the data, and make sense of it. Now, if we have a critical mass of researchers in Nigeria, no matter how small
Mm.
this group of researchers are, if we have them across the country doing the same thing, now chances are that there will be a time when this group of mentors will have trained a significant number of people that will go on to also be mentors for other people. Now, part of the reasons why we have committed to doing this in Cameroon, myself and the other research associates that I work with, my team, is because all of us have trained outside Nigeria, and we were beneficiaries of a system that actually was very generous to us. A
Yeah.
system that gave us an opportunity to do research without paying a dime, because we
Mm.
met research funding on ground, and that research funding covered part of our stipends, part of all our research consumables, reagents, and everything. So what we're doing now, I don't think this is something something special. This is just our way of giving it forward. Besides, we are using research grants to fund everything that we do. Now this funding doesn't belong to me. It's not personal funds. Now these are research funds that must be used to carry out research. So what better way to carry out research, and in the process somebody benefits from it? And I see it, like I said, as a way of paying it forward for the generosity that I have benefited, that we have benefited in the past. We're trying to ensure that as many people as possible benefit. And the idea is, we think that if we not I mean we're not expecting all of them to actually turn out like us, mentors like
Yeah.
us. Some people may decide to leave research
Yeah.
completely, but then what we're expecting is, for those people that remain in research, we expect that they will also have the same mentality. They will also be mentors for other people, have the patience to mentor other people, actively seek for research funding, pay it forward, so that other younger or aspiring researchers will also be able to benefit from their expertise, from their mentorship, and from whatever research grant that they've been able to get.
It's really interesting to hear that, like, the good culture in which the comrade is working towards to, and I hope you will achieve tremendous efforts,
Mhm,
tremendous achievement with that. It's really because that is really the way out. You don't expect
mhm,
students to be investing, and that is exactly where
mhm,
we need policymakers to make
yes.
amends, so that to encourage research, because the nation needs researchers more than anything. It is the
Mhm,
key to development. It is
yes.
key to changing the things we have been doing that has been
Mhm,
failing for the past 40 to 50 years of our existence.
mhm,
So I hope that will really be important, and we'll have much likes of you. But looking into that, the condition in the moment in Nigeria is still not favorable to a lot of students, because I know we have, whenever you see any program happen in Africa, just take it that 60% of applicants will be from Nigeria, at least,
mhm, mhm,
anywhere in Africa, that we will cut up the criteria. So the motivation is there, definitely. But then, as you said, the problem of funding, like, the economy is not good, and people are really investing their money to do something, to do the research they are not supposed to do.
mhm,
Do you have any kind of advice for students? Because definitely now we are at the stage of sacrifice. How do
mhm.
students cope, and especially in the terms of the mentor mentee, get a mentor? How do you kind of cope with that kind of lack of resources,
Mhm.
and while the burning sensation of doing something good, impactful in research is still going on within you? I know it's a
Okay.
difficult one.
Okay, yeah. So before I advise the students, I think I would like to advise researchers. By researchers, I mean academic staff in tertiary institutions that have over the years been receiving funding from TED Fund. Now, we said, in comparison to the amount of research funding that is received by researchers in other countries, what TED Fund is giving is quite meager. But then,
Yeah.
by Nigerian standards, what TED Fund is giving is actually quite significant, at least by the local context. So now,
Okay.
what I would expect is, we should see other researchers that have received and are receiving TED Fund grants, to also be able to replicate a similar model, as like we're doing in Cameroon. Now, I know that there are so many researchers that have received almost the same amount of funding we have received, but they've not been able to. We haven't seen the impact of their funding in terms of mentoring students, in terms of facilitating the postgraduate research projects of students. So I think, if we have a lot of academic staff that receive funding from TED Fund doing the same thing, then this will go a long way in reducing the burden on students, in terms of how much they need to pay, and of course, it will also go a long way in improving the quality of research that is conducted by our postgraduate students. Now, to the students, yes, like you rightly said, there are a lot of challenges currently. We know that everything is expensive in Nigeria now, and
Really?
even the universities, all universities are gradually beginning to increase the tuition fee for for postgraduate programs, for undergraduate programs. Now, in addition to increased fees for increased tuition fees, now students will also have to contend with increasing living expenses. Now they will have to buy food to eat. They will have to transport themselves. Yes, I can appreciate that this is actually putting enormous pressure on the students, and I hear that some students are even thinking of quitting. Yes, I mean, patience is the only thing I can advise them to have. Yes, it may seem like it's an unsurmountable challenge, but then they need to be patient. Yeah, without patience, it's very difficult to. I mean, everything we've been able to achieve at Cambridge, and personally, things I've been able to achieve. I mean, it's all we've been talking about today are the positive sides, the good sides, but
Yeah,
there are as much negatives and as much failures as there are successes in my story and our story at Cambridge. So, I mean,
yeah,
it's not all shiny and beautiful. There
yeah.
are, of course, challenges. There are
Yeah,
downsides. There are so many problems. So the thing is, whenever you find yourself in a situation where you think, "Oh, this problem is too much. I can't handle it," just be patient. Now, be patient, and once you get past that stage, I mean, you look back and thank yourself for not giving up. I mean, I personally had thought of giving up when I was doing my PhD several times. I know this is the story of so many PhD students,
yeah.
but looking at
Even in
my current.
even in ideal conditions, that is
Yes,
really normal.
exactly. Yes. Even in ideal
Ideal,
situations, people
yeah,
sometimes think of giving up. I mean,
yes,
sometimes it's not because of any physical problem, but because of mental health challenges.
yeah,
People just think of giving up, thinking, why would they? I mean, why are they actually wasting their time doing a PhD? It has happened to me. And
yeah,
there were times I thought of giving up, but then now I am thanking myself and of course all the people that supported me for not giving up.
yeah,
So yes, I
yeah.
feel the pain of
Yeah,
students in
yeah, I think I
Nigeria,
will
and
continue.
they just need to
Yeah,
be patient.
yeah. I think the point is really clear here. With so what you our guest has been trying to tell us is perseverance, because the light is at the
Mhm,
end of the tunnel.
mhm,
Especially now we are breathing the kind of um try to build a new culture in
mhm,
Nigeria. And definitely some people will have to sacrifice. And that is why, especially when it is good to look into history, if you look at the even in the global west where everything is seen to be like flashy and shiny at the
mhm,
moment, it's as a result of those that have really a lot of people die because of bad
mhm,
situation of
mhm.
research, but they
Yes.
persevere and build the culture, and now the system is established, and people appreciate in the places like
Mhm,
that.
mhm,
Yes.
yes.
And so it's really, really important we call upon, because when I look at the data, I see the most literate immigrant in the world, like in the US and the UK, are usually Nigerians, probably with
Mhm,
India, yeah, showing that Nigerians are really productive.
mhm,
Then we all have one problem: the condition at home is not favorable, and I will just linger where things will just work for me.
mhm.
Yeah, but
Yeah.
that is not the way out. We need to build
Yes.
our own home, and
Mhm,
that is the essence of this kind of podcast, so that we will
mhm,
discuss
mhm,
challenges and how do we look into motivating researchers, as you said, and also kind of motivating the younger ones to take career
mhm,
in research, because our own problems will never be solved by anyone but us alone.
mhm,
Yeah.
mhm. Yes.
So moving forward, we are a little bit. I will just try to link. Now we are moving into another phase of research policy. Before we open the floor for question and answer from the for questions from the audience. So, how do you see any connection between your own work you have been doing and any level of on societal on any level of having impact on the society? And have you sought any way to influence policymakers in your work at the moment so far?
Okay. So like I said.
The problems now we're discussing now. Have you
Okay.
sought to discuss it with maybe the governor of of Sokoto State or? something like that. Just, yeah.
Okay, we've not quite started, like I said earlier, engaging policymakers and stakeholders, partly because we still think that our I mean, we're some years away from having that data in humans to actually be confident enough to bring our concerns and our results to those that will change, or those that will change the policies. But then, what we're happy about, at least at the moment, is that the challenges, the problems that we are addressing are problems that directly affect the lives of people in our community, and
Mm,
by extension, people in Nigeria. And just like the example I gave of, I mean, how different diets how the consumption of rice could
mm,
influence the risk of transmission of metabolic diseases and insulin resistance. We also have other projects, for example, that are looking at deficiencies of micronutrients. We know that in Nigeria, for example, pregnant women have a deficiency most times of them, deficient of
yeah.
iron or
Mm,
deficient of zinc or other micronutrients. Now, we're also looking at how these deficiencies of micronutrients are also risk factors for developing metabolic diseases and cardiovascular disease in offspring. And the results are very amazing, very, very promising, in the sense that what we assume, if we eventually, what we think will be the outcome of this is that eventually, if we have data as we have in human, if we get data in humans similar to what we're seeing in animals, that that these deficiencies could actually increase risk of metabolic diseases across different generations. Now, what it means is we will simply just walk up, we will simply engage the stakeholders, policymakers, to let them know that there is the need to enact policies that will lead to supplementation of these some of these trace elements during pregnancy, because these deficiencies are very common amongst our pregnant women,
mm,
and consuming or supplementing these trace elements will reduce the risk of transmission of chronic diseases. By the way, if you look at
yeah.
how, I mean, if you look at the burden of chronic diseases in the past, it used to be that most of our problem was infectious diseases in the
Yeah.
developing countries, while chronic diseases were more of a problem in the developed countries. But now we're seeing an explosion in chronic diseases, even in Nigeria and in other African countries. And then this increase in burden of chronic diseases in no way be explained by adoption of Western lifestyle. I mean, I know
Yeah.
most times we argue that the reason why we're seeing an explosion
Yeah.
in chronic diseases is because more of
Yes.
our people, I mean, people are engaging in the traditional risk factors,
Yeah.
consumption of Western diet, smoking, alcoholism. I mean, if you put all of these traditional risk factors together, they cannot explain the increasing burden of chronic diseases
Definitely.
in our people. I mean, in
Yeah.
developing
I
countries
know.
like Nigeria.
Yes, I know. I know this is the kind of a very, very good question that you will have a lot to say, but the time is not on our side, and we have to
Yes.
open the floor for questions from the audience. I've seen a lot of comments from the comment section saying that people are having unstable network. I'm sorry to hear about that, but
Mhm.
our programs, not only these, but all our programs are all recorded, and you can find them easily on our social media handles. We are on Facebook, YouTube, and Twitter at BioRTC NG. So if you just type it, you will see it. And even this one, you see it. And even if you have a question, you can post it even on social media. We'll go through it. We can send it directly to Dr. Imam for your for his correspondence.
Mhm.
Thank you. We have had a lot of good wishes from the audience. Like really, people are enjoying the talk, so that is a really positive to us. We're really happy to hear about that. And let me see. In case I didn't get go up to ask your question, please can you pause it so that I'll be able to go down because we have a lot of comments coming in. So that is
Mhm.
this one from Al Bashir Tahir saying, "Good evening. Your experience and expertise in research, given your experience and expertise in research, especially in medical field, what is your advice for early career researchers hoping to excel in Nigeria?
Okay.
What do you see lacking and hope to younger generation to work for in order to compete with their colleagues worldwide? Please, can you answer that in 1 minute?"
Yes.
Yeah,
I would say this is a very, very important question and very relevant question, at least in this context. And before I directly address this, I want to address an issue that you talked about earlier, the issue of Nigerians always wanting to leave Nigeria and then to move over to countries where things, the system is working perfectly. I would say that is one of our greatest, that is one of the biggest problems that we have for research. Now,
Mhm.
most of the people that are capable in that have the research skills in Nigeria have all decided to abandon academia and research in Nigeria, and they've moved to better places. But then
Yeah.
the issue is, I mean, those places that Nigerians are wanting to run to, those places, those institutions or those countries did not magically find themselves where they are. It actually took people's discipline, perseverance, passion, and patience to actually bring those places to what they are today. And those are the same ingredients that we need in our researchers. I mean,
Mm.
we need people to be disciplined enough to stay in the country. Yes, there are challenges. I agree there are challenges. And then sometimes it's because, I mean, some people face challenges that may even be surmountable, but they think this challenge is so big that I can't that I
Yeah.
can't solve it. So I just abandon it and leave. If I tell you the amount of problems that I have faced in trying to upgrade our center, you'd actually be surprised. And now I've had
Yes,
people just
actually, we will need
trying
to
to,
hear that probably in
yes,
subsequent program. We're
exactly.
going to invite you again for that we discuss
Okay, yes,
the
yeah,
challenges because it's really important because, and that is
yes.
the issue
Mm-hmm,
because we need people to know the kind of work
mm-hmm,
our
mm-hmm.
our researchers are
Yes.
putting into the place before they
Mm-hmm,
kind of produce that single
yes,
statement they see it, because it's
yes.
it's it's a huge amount of
Mm-hmm,
energy.
mm-hmm, yes.
So that is this
Mm-hmm.
one from Mudathir Adewale saying, "Thank you for your insight, Doctor. There is an argument that studying in Nigerian public universities is free relative to what students pay in university in advanced countries. And it is said that this is responsible for all ill-equipped laboratory facilities. Do you see fee increment in universities as a sustainable solution in addressing underdeveloped university facilities in Nigeria?"
Yes, this is partly the reason why universities in Nigeria are not well funded, because university education, or the university system in Nigeria, is hugely subsidized by the government. Now,
Mm,
when government decides to subsidize education, then what the least the government is do is to provide enough funding to cover for all those aspects that it is claiming to subsidize. Now, but when government is trying to subsidize education, but then it is not providing enough funds to provide teaching infrastructure, research infrastructure, and to also take care of the researchers that are doing the work, then there's really going to be problem. So
mm,
yes, in a way, if students pay more, what it means is there'll be more funding for universities, but then that is just one side of the equation. Now, if the students pay more, where is the money going to? There has to be a proper mechanism in place to ensure that the funds are not being wasted, and the funds go to, go for the projects that they are meant for, and the projects that will add value to research and teaching in general in the university system. So yes, in comparison to what students pay in the developed countries, yes, they tend to pay more. But then even in those countries, there is some level of subsidy. So
yeah.
if you go as an international student, you tend to pay more than a local person studying in his own country. But then what it means is that the whole funds that are generated by the university will usually be huge, so big that the university could actually do something tangible with it. But then, in addition to that, a lot of universities in the developed countries actually get additional funding from industry, from philanthropists, and from other well-meaning members of the society, which is
Mm,
something that we don't see happening in Nigeria. And like I said earlier, part of it has to be lack of, and part of it is because of the lack of, political will from the people in government. They need to enforce companies, they need to enforce private individuals, they need to make sure that private individuals get involved, perhaps through enforcing their corporate social responsibility. They need to do
mm.
something for the university system, for research, to ensure that research and the university system is sustainable.
Sure. Thank you. Yeah. Thank you very much. That is really, really a big one. And it's just as you said, it's just an entire system that one fits into another. You
Mhm,
cannot just isolate one and expect it to work
mhm,
individually. So it's a tremendous work, but s- we will be there. We are
mhm,
optimistic about that. That is another one from there are a lot of good wishing messages, and people are really appreciating your talk. So it's really, really nice to have you. Make sure you check our site on www.byrtc.com to see wherever we are doing in terms of promoting research. And remember, we are open access. It means partly solving the questions we are trying to address, and that is the whole idea of existence of Biomedical Research and Training Center located in Yobe State University. It is an open access research lab housing a lot of equipment, state of art. Some we only have it in Nigeria. It's open access to any researcher in Nigeria. You can go there, spend time, do your research, and be able, and there are good hands to help you achieve what you are looking for, and especially develop the mental stamina and thinking capability, which is required in the scientific community. So that is this question. We only have, I think we are already running out of time. Maybe you
mhm.
can spare a minute, just a minute before we close this session. He said, thank you for a very insightful. Is Camred open for collaboration? What are the programs in Camred for visiting researchers across the country? I think you should check the website of Camred to
Yes.
address that. That is very, very, yeah,
Yeah.
easy. I think
Yeah.
we will not trouble our
But
guests.
if I may add on this,
Yeah.
and the short answer to your question is yes, we're open to collaborations, and just like the host rightly said, we have a website. If you want to get more information on Camred, you can always visit our website www.camred.com.ng
Mm,
camret.com.ng. So yes, we're open to all sorts of collaborations. In the past, when we started, we actually were actively seeking collaborations, and thank God we've been able to establish quite a few. But then now, right now, we're actually overwhelmed by requests from individual researchers, institutions within the country and outside the country to actually collaborate. And
mm,
one of such collaborations is actually leading to something very huge, in the sense that um, we have we are currently working with a lab in Germany. Professor Peter is a microbiologist working with University of Goethe in Frankfurt, Germany. Now he reached out to Camred through another agency in the USA, which facilitates research collaborations between African institutions and those in the developed countries. Now they developed a kit, that a diagnostic kit for detection of relapsing fever caused by Borrelia species. Now they have the expertise to develop the kit, but they don't have the samples to test.
yeah.
Now, part of what they did was to reach out to Camred. Now, part of that may have been as a result of our presence online. I mean, we've been doing a lot in Camred, so they perhaps have seen some of the good things that we've been doing. They
Mm,
reached out to Camred, and right now we're actually testing the kits that they have developed. And very interestingly, we actually have been able to record about 20% positivity rate for relapsing fever amongst patients in Nigeria. Now we all know that this is very huge
yeah.
for Nigerian hospitals and Nigerian patients in general, because we know that most times patients go to hospital with fever, they tend to be labeled as having malaria or typhoid. Now,
Yeah.
if the malaria treatment doesn't work, most times the clinicians say this is because the malaria is resistant, or because the drugs, the blame is put on the drugs, that the
Exactly.
drugs are substandard. But then now we have direct evidence. We've always suspected, because prior to Prof. Peter contacting us to test
Yeah.
his kit, we've actually started. Also have a research team that is developing a diagnostic kit based on PCR to identify the causative agents for different infectious diseases. So now the evidence that we have actually points to the fact that a lot of the cases of fever that go to hospital, which are labeled that present in hospitals in Nigeria, at least in Sokoto, and are labeled as malaria or typhoid, majority of them may actually not be malaria or typhoid. They may
Mm,
be as a result of Borrelia species causing relapsing fever, or in fact some of those other, I mean, infectious pathogens that we're not actively looking out, looking for in our labs. Now, the problem is, most of the problem, the reason why we're not diagnosing these infectious pathogens is largely because of lack of laboratory capacity to test,
Yeah,
to test for these. And on the part of our clinicians, they are not actively looking for these pathogens or these infectious
exactly.
diseases.
Yes, just to chip in, and that is why we need a lot of foster more collaboration, and
Mhm,
that is why we need the presence of researchers to
mhm,
be able to improve a lot of things, to provide data. Usually, what people learn in medical school, what they use, implement in in the hospitals, are based on data from the European nations, but not on our own
mhm.
people. And that is why
Yes.
you need researchers that will work on the African peculiarity,
Mhm,
African problems, to be able to provide data for clinicians to use in the hospital to save more lives. So this is very, very important. We are even ahead of time, and we still have a lot to say. But I hope it is really insightful to any of to all our participants joining us today live, and to all those that will listen to us subsequently. As I said, we are all this program will be available anytime. You can access it on either Facebook, YouTube, or Twitter. And remember to share it. The major essence of doing this is for us to change lives, to motivate, to be able to change the dynamics of how things are going. And it is by you participants sharing this so that it will reach a wider community. I hope you will make people's lives better today by sharing these podcasts with your own connections, with your family, with your friends, so that we have more people coming into the community so that we save our society. I would like to thank our guest once more for agreeing to speak with us today. It's really a pleasure having you in the studio, and we really look forward to hearing more good news coming out from Cameron, especially with the commitment you are having. On
mhm.
behalf of the organizing team by RTC Nigeria Biomedical Research and Training Center, on behalf of our founder, Professor Mahmoud Bukarmaina, I, as the host, Zaid Muhammad, really, really appreciate all our participants and wish you a happy evening. Goodbye.